this will be a little bit in the same direction, and the conclusion will be the same, you will see, because this is the work that Parunaka, our friend, was down and participated in the 3M campaign. And so I will present the results and the situation in Armenia. You see that because Armenia is not a European Union country, so there's more problems than other countries that you're speaking about. So, first of all, I would like to speak, just to remind the 3M campaign. Was the aim of that was to evaluate the awareness and treatment and control rates of the population about the blood pressure, the increase of their blood pressure. So in that program, there were hundreds, more than 100 countries were contacted, but at the end, there were 54 countries participated in this big screening of 642,000 subjects, of which there were 35% were classified as hypertensives. Okay, and of them, 56.8% were aware of their hypertension, and 50% were 50.3% were on antihypertensive medication. And of those treated patients, half of them, 53.9%, were controlled. Controlled means less than 140/90 millimeter of mercury. So Armenia participated with 5,777 patients, and the recruitment was screening was mainly in hospital clinical places, and the figure, the picture is the following. So from these participants, 45% were hypertensive, and 43% of them were aware that they are hypertensive. 33% were on the medication, were treated, and of them, 42% were controlled. Knowing that if you take the global results of the campaign, this this controlled percentage is 53. While in East Asian countries, it's up to 63%. So the mean was 53, and Armenia was 42, so 10% less than the mean. And the percentage of all hypertensive population under control was 14%, which is again low, about 10% from the mean of the old results of the 3M campaign. Okay, sorry, to go back. Yes. Between females and males, the number were the same, but you see some percentage that are controlled. There is difference between the females and the male population, 48 and 37. And it's very interesting was the results on the young population, 18 and 39 years. Their control was better than the other older subjects. Of course, now after this result, we'll go to the European Society Hypertension or guidelines, etc., what they recommend, the classification, and of course, doctors are aware or all about this, and what are the recommendations for the assessment of or to follow up their patients is the office blood pressure measurement and out-of-office blood pressure measurement. Okay? But the situation is that this in Armenia, the ABPM, the use of ABPM is not very used, and only limited number of clinics do it, which gives brings that these guidelines are not 100% applicable, and so the main tool will be the office blood pressure measurement to evaluate and to manage the hypertensive patients. Okay, so and then we have another. If it is office blood pressure measurement, so they should be it should be respected. Yeah? How to measure the office blood pressure measurement? This in this recommendation, I think even in the Western Europe or Eastern Europe, we have the same problem. When you come out of reference centers or clinics, specialized clinics, the general practitioners never apply these rules. Okay? So I join you, and here we'll have, if you don't use this out-of-office techniques, so avoid this white coat and mask hypertension issues. So if you see in centers to measure in both arms, left and right, we do this only in our centers, but never tell me that this is done outside in any country. Okay, once you come out of these reference centers, these are not applied. So at the end, I will give some solutions to these issues that we're discussing with Vasilis increased. So these, unfortunately, these rules are generally not followed. Okay? And in this 3M campaign, there was the possibility to take 3 measurements, and if you make the mean of first and second and third and 3 measurements, there's some, you will find some differences, and which will make, if you see at the end, the percentage will change in a significant way of hypertensive patients. Okay? And after that, of course, the assessment of other hypertension or mediated organ damage with the ECG, with the urine albumin. So from these parameters, not all parameters are measured, and we can say partly is done, are done, and for example, fundoscopy. I don't know if even in Western Europe we will have hospitals that are doing so. If they say fundoscopy has particularly fallen out of clinical use, it's normal for Armenia, and abdominal Doppler, etc. So all these techniques. Let's speak about the pulse wave velocity or ankle brachial index and other parameters. These are really, in fact, there is one center in whole Armenia that can do pulse wave velocity and ankle brachial index with the CAVI device and the sphygmocorrect. You see, it is the center of our friend Paronak for 3 million population, one center to for the assessment of arterial stiffness. It's difficult. So, if we continue with the results of the survey, the distribution was. This is the figure of the distribution, so about diabetic patients, smokers. Okay. Here we have 18%, but in Armenia, the population, the smoking population is higher. In my opinion, here 18% in this cohort is a good thing. Male are distributed equally, and 21% they used alcohol. The recommendation come again to the recommendation of the blood pressure, high blood pressure. Everything is well explained. Doctors are well informed, but when we come to the application of these guidelines, so we have difficulties mainly for the management of elderly patients, which we encounter even in the Western European countries. Okay. So that's why in elderly, over treatment and the decrease of blood pressure is very often going down to 70 millimeters of mercury is very often seen in treated population, in elderly treated population. If you ask the population about their medication, so only half of them, they say they take it regularly, which is this is education of the patient. This is one part, and somewhere here you can add economical issues, etc. So the drug treatment strategy is well explained, but for the treatment, the result is that they are not treated effectively despite the recommendation. What concern device-based therapies of hypertension, forget nothing. It is not for Armenia. Okay. So to summarize this all issues that I presented you, the ABPM, which can be a simple tool for to resolve many masked hypertension, or to follow up the patients after for the diagnosis and treatment of the patient, which is something very important. So it should be installed and used in Armenia. Then more educational activities should be for other tools and for other techniques. And here, I would open the discussion here about the education of the patient and the doctors. Okay? Doctors, in my opinion, for such countries like Armenia or equivalent, they enter in the North African and Middle East and European, a little bit border of Europe. Okay? In my opinion, it is not the education to go to give speeches, lectures, is not sufficient to resolve this problem. Right? There should be more reference centers which are specialized according, let's say, big cities. At least one center should be reference centers specialized to deal with hypertensive patients, so that all the region can send and treat the patient, and the patient will go back to general practitioner and will follow the treatment and the follow-up. This is, in my opinion, one of the most important things that should be done. And increase the number of reference specialist hypertensive centers. Then increase at the same time the number of young doctors that are graduated to come and listen, not only in their countries, and come to participate in societies like our societies and be involved in research programs. This will motivate them, and they will see the results with the with the research results, they will feel them. Otherwise, if every time giving lectures and coming back, this will not change the situation. In parallel, the education of the patient is important, because when you see this the MM3M campaign results from different countries, social, economical level of the country, the results are different. Okay? So, for example, with educated patients in MMA, this campaign, the results were better. The educated patient having 7 or 12 years education than uneducated population who make physical activities. So, to summarize, the results in Armenia were following: 45% were with blood pressure, increased blood pressure, 43% of high percent of high blood pressure, and treated patients 33%, and controlled 42%, which, as I told you, it is lower than the mean of all these 4 countries that participated in this study. Thank you very much.